So when my family and our loved ones were asked to convey his medical wishes while the question came at an impossible point in time, we were prepared. So many Americans are not prepared for when this question comes, but taking control is possible if you have time to have this conversation. And we just know that the emergency room and the ICU are the wrong places to be having these conversations. Hi, everyone. My name is Matti Perilstein Burnett. I'm the CEO and co-founder of Eternally. And we started a company to help patients and their loved ones before the most difficult times of their life. A little bit of a personal story about me. My Uncle Jay was a concert pianist, and as a family, we always knew that a meaningful life to him meant being able to play. So when my family and our loved ones were asked to convey his medical wishes while the question came at an impossible point in time, we were prepared. So many Americans are not prepared for when this question comes, but taking control is possible if you have time to have this conversation. And we just know that the emergency room and the ICU are the wrong places to be having these conversations. That's why Eternally helps with this before a medical emergency. Eternally supports advanced care planning. We're taking control and doing things like naming healthcare power of attorney, creating a living will or an advance directive with the patient and their loved one, and helping them make decisions that are right for them and making them known before that point in time. What we've seen in our country is it's not happening. And as a result, patients have an average out-of-pocket cost at end of life of $11,000. It's not happening because aging isn't a diagnosis code, and our medical system treats for diagnosis codes for specific treatment paths. And without that, it's just not being done. So what Eternally does is connects directly with healthcare organizations like large health systems and post-acute care facilities. And when we meet with patients, we're connecting with them when they're both physically and mentally available. So patients get to choose when they want to meet with us, and they can bring their families along too. When they're meeting with Eternally, they're meeting with an advanced practice nurse practitioner. These are folks that are going to provide that medical guidance, that education that most patients don't have the opportunity to get. These patients are not those that have access to estate attorneys or financial planners, let alone printers, scanners, fax machines. That's why our solution is extremely accessible. There's no app to download. There's no portal to access. We're having these real conversations in an emotional and compassionate way. Once the conversation's done, we're making sure those decisions are memorialized and shared back with the patient's family and provider so that they can be known in the event of a medical emergency. We have 6 live paying partners. These are not conversations or possibilities. These are revenue generating opportunities that are live across 4 states. We are so proud to be speaking with over 500 patients today, and we hope to grow even more next year. Our business model is fairly simple. We've gotten in really fast by having multiple streams of revenue. Number 1 is the B2B partnership, which is making sure that patients that are having conversations with us are getting connected back to their providers. So those decisions that are going back are actually stored in the EMR. But the bulk of our revenue is through this reimbursement model, where we're using existing bill codes to generate 100% of this reimbursement revenue for Eternally. And that has allowed us to be a bit self-sufficient. We know that this is not a one and done for patients, that oftentimes this is just the first conversation that they're having because they're getting access to this for the very first time. So we know that there's conversations that are going to come back to, like what does palliative care mean for me, or how might my spouse have this conversation as well? And that's where we think about the lifetime value here. I told you a little bit about myself, but the real magic happens with our team of clinicians. These are the folks that are passionate and engaged because they know it's not happening in our healthcare ecosystem today. They not only have the EQ, the IQ, the credentials, but they have the EQ, the compassion to meet their patients and their loved ones over the screen or over the phone. Today, we're raising a $3 million seed to fuel our growth. We know that there is need. This is only happening in 3% of the systems today, based on what we've seen, based on the data of the baseline health system collection of advanced care planning. So we know that there's an unmet need within health system partners today. We want to hire in sales and marketing and business development to fuel our growth. Thank you so much. We look forward to supporting your systems and your families.
Matti, appreciate that. This is just one of those products that's going to help so many people. When I heard about it, I was like, yes, please. For me, my spouse, my parents, my in-laws, just one of those things that makes a lot of sense. And yet, folks have struggled with this in the past. And so I kind of want to ask about the competitive landscape. People are trying to do this in different ways. Is there competition in this market? And if so, how are you approaching that landscape?
Yes, thanks so much. So of all the competitors out there, we fundamentally disagree with the tech-only or direct-to-consumer-only approach. Eternally is a people plus technology solution. We are a tech-enabled service because we know that this conversation is tough. And it needs a vulnerable person on the other side of the screen or the other side of the phone to make sure that they're meeting you where you're at in this journey and feeling supported. So our competition is largely tech only, where a patient might log into their portal and answer questions on their own. This really requires a type A and very well educated patient to make those decisions without any guidance. The direct-to-consumer companies out there today are doing a great job of providing medical and logistical information around how to make these decisions and what to do, but they're really not engaging the final step, which is actually getting it done. And that's what we're able to do.
Very nice. We got a question in the chat from Esther Dyson saying, do you get customer feedback saying that you help them change their current lives to have more meaning as well as to deal with those end-of-life decisions?
Thanks, Esther. Yeah, we start by having conversations around what does a meaningful life mean to me? It's a very philosophical question that doesn't often get asked in the traditional healthcare setting. So when patients go through this experience, they feel so good that they're able to take control and make those decisions. I named the company Eternally because I knew I would feel eternally grateful if my loved ones, if my parents did this for me. So I didn't have to have that burden or guess how they would feel in different medical emergency situations.
Very nice. You mentioned a couple of times about how the difference isn't as much what you say, but how you say it, the EQ piece, the emotional portion of this. Mm-hmm. How do you train that? How do you think about making sure that your team echoes that concept?
Yeah, well, our team has on average 12 years experience across the board. So they've been in the trenches, they've been on the front lines. They know what it feels like for loved ones when they don't know the answers to these questions. So oftentimes they are pausing and listening and making sure the patient has the opportunity to ask whatever question that they have. And it's really reading the conversation that they're so good at. When patients are not sure how to approach a certain life-sustaining treatment event, oftentimes they're playing out different scenarios for patients, understanding why life support might be necessary. If you have family that needs to fly in from Boston to California to say their goodbyes, or even just to make sure that we're exhausting every option of treatment before those final decisions are made. So our nurses are very well educated in those scenarios and often provide personal experience as well as hypothetical situations that help guide those decisions. Again, we're not steering patients anyway. We're just making sure that they understand what it feels like for the patient and their family in these situations.